Welcome everyone to the session. I assume you are here because you are a little concerned about fossil fuels and you are already deeply engaged and focused in that work, or you want to dive in and learn more. So we know that we have a pretty wide breadth of who is in this room. So I just kind of want to get a sense of it. Who here is engaged in some active campaign around fossil fuel education, fossil fuel infrastructure, communications? Who feels like they're pretty much already in this?
Done it in the past.
Well, okay, yeah, so we got a lot of folks. I will move through my initial slides pretty quickly then. Is there anyone who is here because this is something they have been wanting to learn, to really dive deeper in on the climate and health side of things, supply side organizing? Okay, great. Well, welcome everyone. So today I just put up this fall solution slide because I think it's so good as folks are filtering in. But I will really quickly just give a quick kind of quick and dirty if you are brand new to learning about the fossil fuel industry and its history, really give a quick overview. And there's so much good data that's been compiled on the health impacts of fossil fuels. And so on your table are some of the highest quality infographics out there. So we're not going to spend a ton of time diving into that because we're at, we want to really make space for our incredible speakers to hear about what they're doing and how they're leveraging the health professional voice, but all of that data is out there. And you can find all of those resources also online. So to start us off today, I just want to give an overview of where we're going for this session. So I'll start us off, like I said, a really brief overview, why fossil fuels are bad for health, what has been the role of the industry. Then we will hear from Abby from Wisconsin, who's right here, who has been really deeply engaged in fossil fuel infrastructure and climate health professional education on fossil fuels for years. And we have Dr. Bradford from Louisiana, who's a part of the Sierra Club Delta chapter, joining us online, which we're really thrilled about. And so we'll hear from her. And then we will hopefully spend the last 20 minutes or so just discussing at our tables and learning from one another. So we have a pretty solid group gathered here, but we're hoping to be able to organize ourselves by topic. So we'll have a breakout group on communications, one on educating the general public, one on fossil fuel infrastructure fights. And so we'll figure that out when we get there. But we have some facilitators in the room who volunteered, and we have some great facilitators on Zoom as well. So we want to be able to spend a good amount of time learning from one another because there's already so many good insights in this room. And we've had so many amazing speakers at this conference, but I think it's also, I want to make sure we have like lots of space just to talk to each other. So with that in mind, I will just get started on a couple of these slides. Sorry, this is the wrong direction. So these slides are actually from Dr. Lolita Sudapaneni, who could not be here today. She is at a dentist appointment, or else would be joining us online. But I was like thinking about what slides I would make for this presentation, and I was like, who already has the best slides on this? Lolita. So, and we actually presented these when we were in Texas together, educating some medical students and trainees and other health professionals. So this is, I think I'm operating on the assumption that most folks in this room know this information already. So I won't go through this. You can definitely ask Lolita for her slides. They're really good. And she has been so deeply involved in spreading the bad word about what is happening with fossil fuels and why it's such a dangerous source of energy. It's people with bodies. Yeah, just if you have a body, it's not great. If you don't, that's cool. I think there's some folks working on that human robot innovation. But for now, so okay, I'll go back to this and try to see some picture takers.
Thank you.
But we can definitely, I'll see if the lead that feels comfortable circulating these. But it's just, the quick and dirty is it's really bad. It's so bad that you're like, how have we decided collectively as a society that these are acceptable impacts for our source of energy? And so we had a whole first session at the meeting last year that really dived into, we brought an expert in who has done all of his research on the industry and the fact that they've known this for so long. And I think this slide just really gets me every time to see just like what a really concentrated effort this was. And I think when you're doing climate advocacy or in this topic, you're like, how did humanity fail so badly? And I think it can be important and grounding to be like, it wasn't just that we all collectively messed up. It was a pretty effective strategy that's been implemented before I was born. And that I think is grounding. And it's important to understand industry strategy so we can craft our own strategy. And so this is just a little bit more on, as health professionals, what we're up against. You know, the public understanding of the industry and of energy production is really influenced by incredibly well-funded marketing campaigns that we really have seen, and we'll hear today, that the power of the health voice to combat and overcome some of that messaging, but it's really pervasive. Like the fact that carbon footprint was invented by the industry as a concept. Fun fact. And so yeah, so this is the basic messaging that we are up against, and that how it has evolved over the years. And now I think also maybe there's a second one here, or an addition. Maybe the last one would be something on false solutions, which we're going to hear about a little today. This is the Exxon New graph, predicting essentially exactly what's happened on the growth of atmospheric CO2. So essentially, it's really bad. The industry knew. I think we've heard this message delivered a couple times already during this conference, so I'm not going to dwell on it. And this slide is from Dr. Ben Franta, who presented to us last year. If you heard him, he's great. But a lot more of the deep dive is on the sheets on your table. And there are many of your colleagues in this room who have a lot of great experience on how to communicate this information. But these couple of slides, I think Abby's going to talk more about this, but you know, really putting forth the science and also providing a little bit of background on what we've been up against. But I will leave a little bit of that to Abby. And I am going to pass it to her now and bring up her slides.
Okay, so thank you for that great review, Bev. So we know we have the science behind us, but those types of slides that you just saw, those are the kind of things we'll be showing again and again to health professionals you talk to, because they often find themselves in a spot where they feel very, very frustrated about what's happening, and they don't understand that we are being marketed against, that billions of dollars is going into this. And so a few of those intro slides, when you're going out in the community, when you're trying to get new advocates to join you, when you're talking to just community members, are going to be incredibly helpful, because what did they make you feel? What are some of the emotions in the room, like knowing that for over about 40 years, 50 years, maybe even longer, this has been a laid out plan? Can someone just shout out a few emotions they're feeling?
Anger.
Indignant. Anger, I heard stupid, I heard betrayal. Okay, does it make you
anger in the
how
chat?
does that anger make you feel? Does it make you feel like you kind of want to like do something with that?
Yeah.
Okay, that's what you want people to feel. That is the kind of communication that you need to use to make people do something. When people feel like this is all in them, that's really debilitating and they don't really want to do anything about it. So I'm going to talk a little bit about what we've done in Wisconsin. This is a little bit of what I'll focus on today. I'll talk about like how do you pick what type of fossil fuel fight you want to do. So that's what the focus question is, what it looks like, and then a little bit of the benefits. So we have a lot to focus on as health professionals. Everyone has full-time jobs, or if you're a scientist in the room, someone not in that sphere, you're constantly trying to figure out climate change is a huge issue. What are you going to talk about with your team? So there are, even when you're talking about direct fossil fuel fights and the supply side, a whole lot of other things, even in that realm, that you can focus on. You can focus on policy, such as Superfund, which we heard about yesterday. You can focus on legal battles. So we've heard about states suing. You can focus on infrastructure fights or the communications. I put communications are part of all of this because you can't win on any of those other things if you don't communicate about it and if you don't have advocates helping you. And then we have to balance that with everything else that our groups are interested in or you're working on otherwise. So whether you're in resiliency or climate smart healthcare curriculum, you're trying to figure out where is our fight going to be and what do we need to win. So I want to be clear that I'm going to focus a lot on infrastructure, and I'll explain how we got to that. But I know you are all dealing with a lot of different things, and I want you to think about where's our power, what is feasible for me and for our group, and what aligns best with your values. Because I'm going to argue that fighting supply side aligns with all of our values as health professionals. So this is a little bit of how Wisconsin decided on our focus, because I think it can help you see how that overlays. So we obviously would love to do more policy, but if you don't know, Wisconsin was one of the most gerrymandered states in the country for decades. We got new maps, but when we talk to policymakers and when we look at the outcome that we could have in Wisconsin, we still have another year or so before those maps actually change what our legislature looks like. We saw the first year of new maps this year, but it didn't replace all of our Senate. We have to wait 2 to 3 elections before we'll see a fair legislature. So we're a little bit on the way. So when we look at this, we said, okay, maybe Superfund and some of these things aren't within our wheelhouse yet. And then we looked at the legal side of it. We talked to different legal experts, and we had actually a great youth group in our state pushing the Attorney General. And you can see in this article here, our attorneys general every time says the quote, "We're waiting to see what happens in other states before we play this out." This is largely a budget issue in our state because our governor is the only Democrat on the 3 levels, and they're not going to spend extra money on something they're not sure is going to win. So we said, okay, what else can we do? Well, we happen to have a lot of infrastructure we can fight. So on the right here is a quick map. It's going to look a little confusing because we identify for all of our health professionals what utility it is so that they can learn if their utility is proposing something nefarious. And we currently have 7 new gas plants. So all those circles that look like pie charts are actually gas plants. We do have 1 win up here, and I'll talk about that, where we successfully defended against a gas plant. And then all these triangles are existing ones, because we find it's really helpful to show people we already have a lot of fossil fuels on the grid. This is about whether we're putting new things on the grid in 2025, 2026, 2027. And the reason I also have this overlay of purple here is we also found that a lot of these are in legislative districts, and these are swing districts for our next year. So we believe this is going to be a big policy push in our state. Because if we can get constituents in these areas to see fossil fuels as something, and their energy system as something that impacts them, that is going to change the communications in all those places, and maybe then we can win on policy. So you need to be thinking about all of these factors when you're deciding. If you're working on the state level, I know some of you work on federal level or work on the local level, These are kind of some of the different ways you can think about where the power is, what's feasible. And then you have the values on the left. We're all science-based. We just talked about the science of why this is so important to our health. But I would argue if you're not looking at supply side, you might actually be ignoring some of your health equity and justice space. Because when I go out in communities and I ask those on the front lines what they need help with, they say, well, they're building a gas plant next door. They're building another pipeline through our reservation. They are doing, and so they're ready and asking and already organizing these fights. And if we're not paying attention to those, we might not be building the best partnerships we could. And this is also a great chance for relationship building. I'll get into that a bit more. And then the other things I was going to say is we really can't win in the climate movement if we don't have frontline community-based voices at the table. That happens in these fights. We don't have unions and the workers. That's a huge part of the supply side. Rural Wisconsin, this is for our state, but just rural areas in general. It's actually 60% of fossil fuel infrastructure is built in rural areas. So this is a great way to talk to rural communities. And then we need to be talking about utility bills, economic sides of this. And if we keep building fossil fuels, it's going to become a stranded asset. How many people know the term stranded asset when I just throw that out there? Okay, so if you're not sure exactly what that is, I saw some people didn't have hands. It's basically if we build it now and the energy price goes way up, they end up shutting down a plant early, but people are still paying for it. So you as a consumer can end up paying for energy that you are no longer actually getting or using because the market has changed so much. This is what's happened to coal for a lot of communities. It already happened in Wisconsin, and you can talk about that. So sometimes I go out in a community and say, hey, do you know that you're paying $274 on your energy bill this year from coal that you're not even getting the energy from? And people go, are you kidding me? And that's a household number. So we're trying to avoid that because we can't get policy. So here's what it looks like. There is a role for everybody in this. So if you are in data and research, here is one way that can look. This is the Cobra tool. We use this a lot. Yes, it is still, cross my fingers, knock on wood, on the EPA site right now. So you can go to this right now. And you can plug in the emissions from a project. All utility applications or fossil fuel applications do have to apply for permits where you can grab their emission information and put it in there. It's just a plug and chug tool, teaches you how to do it. And then you can get information like this, which we have on the left side. So this shows we can put this out in a community and say, hey, these are the impacts from the gas plant that's going to be built in your community. If you show this to a policymaker, they will be concerned. If you show this map here, which this is InMap, this is a different tool, also accessible and free, but has been really helpful because sometimes people in northern Wisconsin are like, why would I care about this gas plant way down there? And you can say, hey, air pollution isn't stagnant. This is the health impact that can be projected, and that is actually health costs on that map. So we need more researchers. We're also have some pretty big data gaps when it comes to false solutions and health and some of these other things. Now moving into other ways you can help. Writing is a big way. So on the left-hand side, you see a letter here that we built with other health groups. This is going to our Public Service Commission to put on the direct docket. On the right, this is just a look at some of our coalition work. We're leading an effort with about 40 groups in Wisconsin right now pushing against gas build-outs in our state. The reason I say you have a big voice in this, when we started this work, they said, well, we think we might just say they can build some of the gas. And we were like, that's not great political leverage. If you think maybe they're going to end up in the middle, you need to fight for none. Right. And it was health groups actually that said, hey, we're not going to say that when it comes to health. There's no good level of air pollution. So if you want us to be one of your leading voices in this effort, that's our line. And that was also the line that all the community-based groups were. They said, hey, this coal plant's been in our backyard for 50 years. We're not letting it go to gas now. You're saying we need another 50 years of pollution? So it also helped those big green groups listen to the community-based groups. And now we have a full coalition based on no gas as our public messaging. So I want to be clear, your voice also can move, like you don't have to have all the resources as one small health professional or one health group. You can also move other groups that also have resources just by sharing the health message. This is a little bit of what our education and outreach has looked like. This is primarily community outreach. So that's why you mainly see us in t-shirts, except for the top left, which is a lunch and learn in a federal qualified health center. We've been hosting lunch and learns in different clinics near these projects. We've now hosted 7 or 8 of them just within the last couple of months. So we basically come to a clinic, ask if I can teach them about air pollution and health, and then at the end we teach them about the project in their backyard. They have lunch with us, it's great. Gotten about 54 new health professionals in the last couple of weeks joining our organization just from lunch and learns. On some of these other ones, these are tables at various events. So going out in the community, this is actually a bike race where we taught them about energy burden and fossil fuel impacts. So what you see is a wheel there where they spin to see what they would pay on an energy bill based on their income. And then also all sorts of other tabling and teaching events that we've done working with other groups. A little bit more, if you are someone who feels comfortable talking at a press conference, this is a picture of a public health professional talking in front of one of the coal plants that's going to be converted. That's a conversion. We have some new ones as well. And then this is a rally video, and rally communication looks very different than press conference communication. So I'm going to give you a little example of a health professional speaking at a rally so you can hear a little bit of what something like that might sound like.
Here to say as clearly as possible, methane gas plants are bad for your health. Methane gas is a fossil fuel. Burning fossil fuels creates air pollution. This air pollution harms our lungs, our bodies, our children's development, and there is nothing safe or natural about it. My family and I live 5 miles from a huge, large methane gas plant. Our county has some of the highest asthma rates in Wisconsin. Our community has some of the highest asthma and chronic disease burden in the country. This is not all. Air pollution exposure from methane gas plants is associated with autism and lower academic scores. Air pollution contributes to heart disease, autoimmune disease, and early death.
You can see she just clearly lays out what she is seeing in her community. And then the chant that everyone was chanting right after this was public health over corporate wealth. And that is what the news picked up on. So the next day in the news, you had a bunch of people chanting public health over corporate wealth in the news. And that hearing that you saw her at, she was one of many. This is a hearing just last month in Wisconsin. We had over 14 health professionals testifying. So you can see some pictures here. They were able to testify either on Zoom or in person. And then we had 54 Wisconsin-based health professionals comment. There were actually about 70 health professional comments around the whole country. And this is just for one of those 7 projects. So we are actually on stage 2 right now. But what are something you kind of notice about these pictures? Who do you see you're advocating for in these pictures? Children.
That's easy color.
Yeah. So do you see how some of these frontline groups, it can be important to be there? Press, interviews, and writing. So this is another way you can get involved. One of the pictures isn't showing up here, but this is just a look at how some of those things can thread together. So all of these things start showing up hand in hand. But this is how that study ended up being featured in the press. And then it was pretty cool because they released this like 5 days after that rally. So then you had a video underneath this. They're singing that public health over corporate wealth. And then you have a whole series of essays. This is just within the last 2 months. We've had over 35 mentions. And not all of it is super clear, but like look at how often you see health come up. This is just the headlines. This is about 10 different papers. And so I want to be clear, like this is just a few health professionals starting some of this. And then once one health professional sees another, you can get growth. And then we try to amplify it wherever we can. So we take videos from the hearings. For those who can't make it because they're in clinic, they send videos to us. So here's an example of someone sending a video that they recorded to us.
My name is Kristen Lyerly, and I am an obstetrician gynecologist from Northeast Wisconsin. There's a lot happening in the world right now, that's for sure. But one thing Wisconsinites need to be aware of is this. We Energies is planning to build 2 new gas-fired power plants right here in our state. They project that these plants would release nearly 1,500 kilotons of greenhouse gases annually. This outdated technology will cost us more, damage our climate, and cause physical harm, more asthma, worse birth outcomes, and earlier death. It's really that simple. So what can you do? And there are things you can do. You can support renewable energy in your own home, and you can choose leaders who understand that fiscal responsibility and renewable energy actually go hand in hand. And you can check out organizations like Healthy Climate Wisconsin. We are health professionals from all across the state who take care of you from the exam room to the air you breathe.
Underneath that, there was a tool.
Yeah, right? That's lovely.
And then underneath that, there's a tool and it helps people comment right there as soon as they see the video. So that's just one example. Here we have another example, and I'll just kind of go through a little bit of this.
Play it.
You want to play it? You want me to hear another? Okay, another
As
example.
a physician, I see the transition from coal to methane gas as similar to having one of my patients quit smoking, then start vaping. Both are bad for the health of the patient as well as the environment. We want something better for Wisconsinites. We want to transition to clean, renewable energy.
Wow, that's a good one.
They can be very simple. You talk about what you know. This is another like highlight video. I know we're not going to be able to get through it all. I'll share my slides so you can watch videos of health professionals doing this. This is about a compilation about 6 nurses talking at one of our recent hearings. And so let's say you're not one of those people, you don't want to talk about it. There's other ways you can give guidance, make materials. So we had health professionals weigh in on what our materials should look like. So these are things that we're giving out in communities. We have kind of direct health impacts. They look a lot like your sheets on the table. We have materials in Spanish about hearings. We have information. We've tried to distill things into like 3 to 5 talking points is usually our rule. So that's what you see on the right is like 5 things you could easily say when you're talking with a community member. So that one on the right is meant for health professionals. The one on the 2 left is more meant for community members. And then this is just also having some fun. So if you're just like, I am a health professional and I want to get a little social, I would also argue that working on the supply side, there's a lot of room for just like connecting communities. So this is an event we held in northern Wisconsin. Yeah. And the reason we look like all sweaty, it's 103. What was it, 103 that day?
Yeah, it was pretty hot.
Yeah, it was miserable. Talk about climate. But we planned a concert in northern Wisconsin as a way of helping people understand the clean energy impact there, and as a way of building an identity for health professionals around us. And then on the top right, you see the exact opposite season. It's Christmas because our utility funds that Christmas tree and like makes a big deal out of it every year. So we were exposing and we did a community theater presentation where children opened up their presents from the utility and they were getting inhalers and they were getting masks and high utility bills, like comically large utility bills. And we were exposing because the news does like comes to the unveiling of the Christmas tree. So they were treated to a bunch of health professionals doing community theater instead. Okay, and then so here are the benefit side. The biggest thing I would say is this has been huge for new membership for us. So you can see in this article, literally a health professional joining our team. So on Wednesday night, Healthy Climate Wisconsin and Grace Lutheran Church in Kenosha hosted an emergency meeting. Many who attended were unaware of the proposed projects, including Veronica King. I was shocked, said King, a mental health professional. Once she began doing some research, she expressed her concerns over the impact it could have on residents' health. So because you're going directly into communities and actually talking with people, you end up getting a lot of new members. As I mentioned, we've had like 54, I think, it was 54 just last week alone. I did not check this week. I've been here. So there's lots of new roles and types, like I showed earlier, ways you can get involved. So it gives you a lot of people an immediate action because it's like, oh, I can go talk to my neighbor. I can take immediate action because this is within my community. I know my people. And so it helps people feel like they have something they can do more immediately than some of these bigger asks that we've had as an organization. And then it also is an intro to organizing because people have to think of their network. They go, well, I could talk to my kid's school teacher because maybe she would be concerned about the impact on brain development in kids. Or I could talk to my neighbor down the block because his dad has a triple bypass. You name it. They start thinking of their networks and they start learning organizing skills by doing that. And then another big benefit beyond getting new members and new health professionals is stronger partnerships. So this is just from one of the partners we've worked with. When Healthy Climate Wisconsin showed up big at the hearing, you can feel the power. We know these health impacts, we've been living them, but when health professionals stay beside us, it shows how we're heard. We can't deny our health harms are real when there are physicians saying it. Another example, it makes a difference when health professionals like Victoria show up to Service Commission hearings. Victoria's been showing up to hearings for 3 years, so she always gets a critical mention from our partners. And it's a tangible win that can snowball. So we've won on one of these now, and now the other communities are excited. As reference, this is a Wisconsin reference. This is actually our university, the students rolled a snowball down the street and blocked all the traffic. And so I like to use this as my meme of we're gonna block all of the new fossil fuel infrastructure and then that effort is gonna snowball. So here's an example of a real win. This is a community health forum we held up in Superior, Wisconsin. This is the northest you can get in our state. Really like pretty rural industrial community. We held a panel with an Indigenous health expert and then 2 of our health professionals. And this was the city council hearings. These are actually 3 different hearings you see here that came within the 3 weeks after we held that forum. And you can see the community members are showing up and the message that's resonating is the healthy, breathable future. And we actually helped with the sign design and had over 7 or 8 health professionals testifying at these hearings. And I'm happy to share they were actually denied. So the city council voted to reject siting for the plant after community members showed up for 7, I think, different hearings in a row. Like that, all in number with their signs testifying. Then you also had health professionals. We sent over 100 letters to local city council members telling them about health impacts. And you see here, it's highlighted in the way it's projected in the news. And now I remember walking out of the hearing where we won. And one of the neighbors who I'd been working with for those last few months says, now we're going to do the oil refinery. Because they live in the town with the biggest oil refinery in the entire Midwest. So Actually, not the entire Midwest, in the state. So it's addicting. Once you win, it snowballs. And then now they've officially withdrawn the permits, even beyond the city. So that's a look of what it can look like. I talked about relationship building. It also happens with decision makers. So this is one of the city council members sharing how impactful the health professionals were, because she was in the district where the plant would have been built. Her citizens had been upset about it, but not showing up to hearings, and it was the impetus that really made that. And it led to a bunch of clean energy build out. I won't touch on this too much, but basically, if they can't build gas, they have to build clean. And what we saw after that was the same utility that we got the gas rejection from was willing to finally meet with us and then applied for Inflation Reduction Act funding, and they got it. So it can happen. And that's my last slide.
Give it up for Abby. We will not have time for questions, but we will have a breakout session after this. So, and Abby will be around for the rest of the day as well. So Abby, thank you so much. I am so inspired hearing those stories and seeing that roadmap for how this is possible. And I think sometimes it feels like the industry is really winning and it's not possible, but we really see that it is. So
It looks like she wants to share from her screen.
yes. Okay, let's make sure. Did I not make her a co-host? Hold on.
I said allow. I just
Okay,
pushed the
great.
button.
Then that's golden. Okay. Can we
Okay.
hear you?
Yeah, can you hear me?
Okay, perfect.
All right, awesome.
Well, we're
I'm
passing
gonna
it to
try
Dr.
and
Bradford.
go super quick. All right, I'm Angelle. Angelle Bradford Rosenberg, and everyone just calls me Jell. I am the chapter chair and manager for the Sierra Club Delta chapter here in Louisiana. I use she, her pronouns, and I'm also like my actual training because I'm a volunteer as the chair and manager of the Sierra Club Delta chapter. I'm a medical scientist in physiology and medicine. I finished my schooling at Tulane School of Medicine here in New Orleans, also known as Bulbancha. My work in medical science has taught me a lot of things as it pertains to advocacy and climate. And one of those things, of course, is that environment has a strong role in the many diseases that we see. And I studied cardiovascular disease as well as diabetes and recognize that the why of why folks experience those diseases is as important as the how. And so I think we often get stuck on like mechanism and how do those things happen, but why is just as important. And I live in the deep south, so I think a lot of folks will often say like, it's diet all the time, and black and brown folks in particular will get blamed for lifestyle and diet, but we don't do enough to find out about environment and how that impacts people. And so that led me to have a very strong interest in the climate crisis and environmental justice, and better understanding the role that I could play as a scientist and a researcher at our state capitol in particular, but also in DC whenever I would advocate there. And sometimes I use my voice as a scientist and a researcher, and sometimes as a random person or a volunteer. I try to be very thoughtful based on the audience whenever I use my voice. If it's just in community, I don't feel the need to really throw around titles unless that's useful to the groups that I'm working with or the people that I'm working with. And if it makes sense for the legislator, I may dive into that and get into the data and the science, depending on if we're having a hearing or if it's a strategic thing to do for the group that I'm working with. So sometimes the science makes sense, and then sometimes it's good to just kind of like throw down in community and organizing. So my lens is very much from Louisiana, from the Deep South, and I wanted to make sure to lift up that a recent IEFA report, and IEFA is the Institute for Energy Economics and Financial Analysis. I wanted to make sure to get their name right. They recently released a report demonstrating that oil and gas is desperate to extend its relevance. So Louisiana, we're known for our oil and gas past, and once it was among our most economic benefit. It was our greatest benefit economically for our state. But now we rank 49th in GDP and population growth. So our petrochemical industry was once 33% of the state economy. It's now 14%. and faces a pretty uncertain future. And so the two most important drivers of the state's petrochemical industry, ethylene and methanol, are areas that are being proposed for expansion, even as demand is slowing and risk factors are mounting. So it's important to recognize that the petrochemical industry is very desperate to expand its footprint here in Louisiana and the Deep South and Mexico and the Gulf South, but they don't have to. We can push back on that. This photo is of Cancer Alley, so just a picture between Baton Rouge, along the Mississippi River, between Baton Rouge and New Orleans, and it's an overlay of the Black population with the industrial area. And the darker blue areas represent the Black population percentage, the greater Black population percentage next to industry, which is the major industrial sites that are in orange. And we find here in Louisiana that our lower income communities and our Black and Brown communities, the greater concentrations of those folks in those communities are along the industry sites, which is what many people across the world have come to know as Cancer Alley. And one of the bigger drivers of production in that area is plastics production. Defend Our Health is an organization based out of Texas that had a recent study that showed that PET plastic was producing, and I'm trying to both navigate my phone and my computer, releasing 1,4-dioxane, which is an industrial solvent and carcinogen during production into drinking water. And so it can damage cells in the liver, the kidney, and respiratory system. And their study also spoke to 150 out of 193 chemicals that leach from the plastic bottle into the water or beverage that you're drinking. And so what was so important about that study is recognizing that it's not just the production, but also just drinking from water, from plastics, that's impacting not just people who live in the Gulf South, but everyone who is, consuming from these beverages in any part of the plastic process and consumption process. And as we discover chemicals produced from plastic processes, we recognize their power to damage organs and cells. The study also highlighted the presence of high amounts of antimony in food and beverages from plastics and ethylene oxide in the air from plastic production, which are known carcinogens. And I will highlight that the EPA was trying to do work prior to this administration to address these carcinogens, but a lot of that is up in the air with this new administration. The majority of the PET plastics related chemical plants in North America are located in Texas, Louisiana, Alabama, South Carolina, North Carolina, and Mexico, and are concentrated near lower income communities and communities of color. Another kind of effort by the petrochemical industry to extend their life is through liquefied methane gas exports or liquefied natural gas exports. We call them LNG exports. And the pretext to really kind of bring these about was the Ukraine war. But most of the benefit has been actually in sending these to Asia and not Europe. And the big hype around them was that this was cleaner because it was cheaper to produce and super cooled, and it takes up less volume for shipping. And this map you can find on the Sierra Club website is of different export sites that are either under construction, planned, or currently operating across mostly Mexico, Texas, and the Louisiana, the Deep South. And we are working hard to defeat them here in Louisiana, but we have 3 currently operating. And so, unfortunately, while the Inflation Reduction Act and IIJA brought great things for other parts of the country, they did come with some boondoggles for the Gulf South and for Appalachia and Alaska. And one of those things was blue hydrogen, which also paired with blue ammonia as a false solution, was essentially the petrochemical industry saying, like, okay, we can produce hydrogen, but this time we're going to sell it to folks as just as this graphic shows, instead of producing with methane gas and water in order to give you hydrogen as a byproduct and carbon dioxide, they're saying this time we'll get those credits from the federal government, and we're going to just put the carbon dioxide and store it in underground. Unfortunately, the science is not proven at scale anywhere in the world, and there have been some horrible impacts in places like Mississippi where pipelines have actually exploded, where there have been attempts to have carbon dioxide stored underground, and led to dangerous situations for communities in Mississippi, where even health providers and fire chiefs and emergency responders could not get to community members a couple years ago. And so, even though that science is not supported as a false solution, we are seeing fertilizer by way of ammonia plants, as well as plastic plants build out being proposed, as seen in this map, provided by Oil and Gas Watch, as well as an additional petrochemical build out of 130 facilities, 108 projects, 70 million CO2 emissions in metric tons. 91 companies, 21 states, and over 1.7 million people will be impacted who would live within 3 miles of these projects. And then a proposed CCS build out, this map provided by GPI, over the next couple of years across the United States. Again, false solution, not supported by science. And then these are proposed hydrogen hubs, which, as I said before, are connected to the quote unquote blue hydrogen or blue ammonia that is proposed by petrochemical companies. Health impacts, we don't have to go over. I think that was well discussed earlier. And then how do we address all of this? And so here in Louisiana, I will be honest with you, I think we're figuring it out in real time. We've had some really strong coalitions with Sierra Club, both across the country and here in the Gulf South, Texas, Louisiana, and then Appalachian Partners, Alaska, who are essentially had kind of like a two waves. So there was an effort in 2022 and 2023 to really push back on the false solution of carbon capture and sequestration that's not at scale, through legislation, through our state capitals. And that was incredible. Fisher folks, people who work in both the Gulf and then also in our lakes, came together with people in our cities and then rural areas who would be impacted by the pipelines, to push back against the state legislature's proposals to give support to these pipelines and the companies. And then our parishes, because we don't have counties here in Louisiana, also stood with us. But then the federal government ended up, the EPA, giving primacy, what's called primacy, to the state of Louisiana. So gave permission to the state of Louisiana to permit those projects. So now we're seeing like a new wave of cross-generational, cross-regional, across the state of Louisiana organizing. But I will also lift up that it's a tougher time now, just because after years of science being under attack, whether it's in environmental science or vaccine science, it takes a lot to build that trust again and educate folks about environment and everything else. So we'll talk more in breakouts, but I'll leave it there for now, and we can circle back. And my email is here for people who have questions, comments, or thoughts.
Thank you so much for joining us virtually. And I don't have it in me to ever cut off my speakers because they're just giving so much good information. So we have a little online. Y'all essentially have as much time as you would like up until 4 p.m. To be in breakout rooms. And in a minute, I'm going to turn the volume off on the computer, and Lisa Del Bono is going to facilitate you all on the virtual side going into breakout rooms. And on our side here, we have quite a few of us, which is great. Hold on, let me just put this is the fun hybrid. I am going to turn our volume off. So hybrid folks, you are folks who are virtual, you're not going to be able to hear us in a second. And Lisa Del Bono is going to take over facilitating, and I'm also going to